Hi everyone, my name is Charlie Scalenda and this is my presentation on clavicle fractures. As a short introduction, the clavicle bone attaches the scapula and the sternum together. This injury mainly happens in the middle third portion of the bone and is either displaced or comminuted fracture. Those images are on the right. And this fracture to the clavicle can be treated either surgically or conservatively. So there are three main causes of this injury. One being falling onto an outstretched arm, a direct blow to the clavicle or shoulder, which is found usually in collisions. And during birth, the baby can get a clavicle fracture through the birth canal. So bones, muscles, and ligaments that are affected by this injury include the clavicle, the deltoid, the trapezius, the subclavius, the sternocleidomastoid, the sternohyoid, and the pectoralis major. Two ligaments are affected. Those include the conoid ligament and the trapezoid ligament. All of those images are found on the right. So a management option is conservatively. Recommended recovery time for this type is usually 18 to 28 weeks to let the bones reattach. Conservative treatment is only used if the bone is not displaced by 2 centimeters or if there is not a 100% displacement. Some complications of this type of treatment include skin necrosis, neurovascular injury, pneumothorax, a non-union, malunion, post-traumatic arthritis, and refractures. The other option for the healing process of this injury is to go through surgery. With this technique, it is recommended that you recover for 6 to 12 weeks. Surgery is done if the fracture is displaced by 2 centimeters or more, or if the bone is comminuted, or if it is an open fracture, meaning the bone has pierced the skin. Hardware such as plates, screws, nails, wires are used to repair the clavicle, which is seen in the image beside. Complications for after surgery include infection, scarring, hardware issues or symptomatic hardware, meaning that pins, screws, plates, they can all break or come loose. And also hardware can cause pain or cause problems elsewhere in the body. So hardware, if it's improperly applied, it can cause nerve damage, meaning you can become like numb for that whole joint or body part. And the removal of hardware is only needed in around 12% of cases. So for conservative physiotherapy exercises, if you are experiencing any pain at any time during these exercises, decrease the range of motion and the repetitions, and also consult your doctor. So for the first 1 to 2 weeks, you're going to be working on preventing stiffness in your elbow and wrist through self-mobilization. You will also be working on maintaining posture as you have decreased muscle growth when you're using a sling or a figure 8 brace. And you'll also be doing range of motion exercises called pendulum exercises. So these are the images that you'll be using to follow these exercises. Very simple. So for 3 to 6 weeks, so the next portion, you will still be doing your previous exercises, but on top of these ones as well. So you'll be using, these exercises mainly are working on range of motion and increased range of motion. So you will be doing these exercises all 10 to 15 times and 2 to 3, 4 to 5 times daily. So number 1 is you use your good hand and lift your arm up in front of you, no higher than your shoulder, as that would be higher than 90 degrees. Ensure there is no pain. If there is, after 3 to 6 weeks, you should see your doctor. For the next one, you will be using your thumb facing up and outwards to the side and move your arm in a large arc. And with your elbow by your side, keep your elbow at 90 degrees in flexion and externally rotate your forearm outwards. This can be done with a light resistance band as well. So for post-surgery exercises, you'll be working on having a comfortable passive and active assisted range of motion up to 90 degrees as the same in conservative treatment. So you will be mainly working on elbow exercises, wrist exercises, and range of motion exercises or pendulum exercises. You'll be doing all of these 10 to 15 times and 4 to 5 times daily. Images and diagrams to show you what you'll be doing. For 2 to 3 weeks, you should be aiming for 75% to full range of motion, and all of these exercises are to be repeated 10 to 15 times and 4 to 5 times daily. So for the first one, you will lay on your back using your good arm, support the bad arm, and lift it to a vertical position. Do not lift your shoulder above your arm above shoulder height unless you are very comfortable. Number 2, while standing, slide the operated arm up the wall in front of you. You'll be standing in front of a wall. Make sure that your elbow does not go any higher than shoulder height, of course, unless you're comfortable. Number 3, with your arm by your side, bend your elbow to 90 degrees and stand facing away from the wall. What you'll be doing is you'll be applying pressure through the wall, and you will hold that for 5 seconds. You will do this exercise for all different directions, so on both sides and towards your front facing the wall. For the fourth exercise, you'll be standing holding a broomstick, and you will use the good arm to push the operated arm away from the body. For number 5, it is the same thing, except you'll be pulling your arm across your lower back behind your body. So these are examples of the exercises. For the next 3 to 6 weeks and onwards, you should be aiming for full range of motion. You will be doing 10 to 15 repetitions of each exercise 4 to 5 times daily again. If you are still experiencing pain, you should consult your doctor. So number 1, you'll be standing or sitting. Attach a resistance band to a hook or a door handle, whatever you can use, and have your elbow tucked into your side. You'll hold the band and pull in to touch your stomach slowly and controlled, and you'll return to that starting position. You should use a rolled up towel in between your elbow and your ribs to make the exercise more comfortable. And you'll be doing this exercise in the opposite direction as well. So you'll be, instead of internally rotating, you will be externally rotating, starting from your hand to your stomach. So number 2, lying on your good side, tuck your elbow onto your side. With your hand pointed towards the ceiling, slowly rotate your arm. You'll be internally and externally rotate your arm. If you are comfortable with this exercise, feel free to hold a weight to increase difficulty. For the third exercise, you will be standing. You will be lifting your arm straight in front of you to shoulder height, and we'll be rolling a ball in different directions along a wall. For the fourth and final exercise, you'll be standing, hands and shoulder width apart, at shoulder height, resting on a wall. Lower your body to the wall. Another way of doing this is a wall push-up. So you'll be pushing through your arms, and you'll be returning to that starting position. Here are the exercises again. Thank you for listening to my presentation.